whatever you're doing, you always have to take care of the amounts that you're doing it in. We always say medications, if you do at a higher dose, it causes an overdose. Similarly, these things in life, if you do excessively, they also cause potential harmful effects.
Thinking about if somebody is going for an appointment to talk about going on the pill, would it be worth them asking about their family history before they go in? Has anybody in our family ever had a thrombosis? Anybody in our family ever had a DVT? Anybody had a blood clot? Would that be a sensible question to ask in the
Absolutely,
family?
absolutely. So, as I said, the reason I was emphasizing for you guys to go to a proper medical practitioner who knows what they're doing is because usually, if we start someone on any sort of medication, we do ask a couple of questions. This does include, did anyone in your family had a blood clot disorder? Whether you, at any point of your life, had a blood clot disorder? Because once we've made sure that there is no risk factor, we can make a thinking what sort of contraception they can be advised. But yeah, that's why I don't advise anyone to go and directly buy it over the counter or by any falsified means. The genetic predisposition is just a risk factor. What are the other risk factors that we've talked about? Again, lifestyle. That's the first and foremost. The way we eat, the way we drink, the way we smoke, everything essentially plays a lifestyle factor, isn't it?
I think also some of the socioeconomic effects as well might come into play there. So people who are from more deprived backgrounds
Yeah,
maybe have been brought up with less health education
yeah.
and less nutrition and things like that. So maybe that is also common factor in this. And I'm way out of my comfort zone here, as you might be able to tell. But I think it's really important that we understand who are the types of people who could be affected so that we don't miss anybody out. So I now understand that somebody who is not white is less likely to have factor V Leiden. That doesn't mean that they're not likely to have clot. And so we need to make sure that they are being examined, treated, and screened in case it is a clot, rather than somebody thinking you can't have a clot because you're not of European descent.
We see many of the people who've gone into long haul flights to a good destination end up getting clots in their legs, which is very common.
So some of the things that I've learnt to do is that I will always wear flight socks.